Hello and welcome to this recording of the overview session produced by Sefton Safeguarding Adult Partnership Board following a recent learning review for Jeff. My name's Nat, I'm the designated professional for safeguarding adults within Cheshire and Merseyside ICB, and I'm a member of the Sefton Safeguarding Adult Partnership Board, and I'll be leading this session today. So the session plan is this. So we're going to have a look at who is Jeff. We're going to have a look at the aims of the learning review. We're going to talk about who was involved. I'll talk you through the key events and the key learning points, and then I'll leave you with some further information. So who's Jeff? Well, Jeff is a gentleman in his early 70s living in Sefton. Jeff had chronic obstructive pulmonary disease, or COPD, and heart failure, and he lived at home with his wife Helen. Jeff was a military veteran who had served his entire working life in the military as a high-ranking officer. Helen described Jeff as an officer and a gentleman. Jeff and Helen married in later life. Helen described Jeff as the love of her life. I wanted to take a few minutes to give you an overview of Section 44 of the Care Act, which is the section of the Care Act which deals with safeguarding adult reviews, also known as SARs. So the Care Act states that safeguarding adult partnership boards must undertake a statutory SAR if certain criteria are met, and it also gives guidance about other types of reviews that partnerships might want to undertake if they feel that there is learning to be gained in order to improve practice in their areas. So the criteria for a SAR is set out in Section 44 of the Care Act, and it says that a safeguarding adult board must undertake a SAR if there is reasonable cause for concern about how the safeguarding adult board or its members work together to safeguard the adult, and the adult has died with the safeguarding adult board knowing or suspecting that that death resulted from abuse or neglect, or the adult's still alive and the board knows or suspects that the adult has experienced serious abuse or neglect. So in Sefton, as in all local place areas, there's a SAR referral and screening process, and anyone can make a referral for a SAR to be considered. In Jeff's case, the SAR referral was made because he died, and there were questions raised about whether or not agencies in Sefton could have worked together more effectively. It was felt that the criteria for a SAR wasn't met because although he died as a result of his pre-existing medical conditions. However, it was decided that there were potential areas for improvements in the way that agencies worked with Jeff and Helen and how they worked together. So therefore, we decided to undertake a learning review, which aimed to critically analyse the multi-agency care and support delivered to Jeff. So who was involved with Jeff? Well, Jeff had a fairly small support network. And as we said earlier, he lived at home with Helen, his wife. He had support from his local GP practice and had received support there for many years. Jeff's GP practice is small, and if any patient, such as Jeff, can't come into the surgery and they need a home visit, these visits are undertaken by GPs from a bespoke visiting service via a direct commissioning arrangement by Jeff's usual GP practice. Jeff also had input from district nurses over the years. He'd had lots of inpatient hospital admissions as results of chronic long-term conditions. Jeff was transferred to hospital by North West Ambulance Service. So Helen, Jeff's wife, was involved in the review from the outset. So I met with her alongside Joan Coop, who's the Safeguarding Adult Board business manager, and Helen gave us some absolutely wonderful insight into her life and Jeff's life. So Helen met with me and Joan, and we explained the reasons why we were undertaking a learning review for Jeff, and we asked her if she wanted to be part of it. She welcomed it with open arms, and she gave us such valuable insight into their lives. So we already know that Jeff was a military veteran, and an officer and a gentleman. Helen herself had also worked in public services for all of her working life, and she has a couple of close family members who work in the NHS in different organisations. So they both had strong internal positive values about public services, and they didn't want to put pressure on services which they knew were already struggling to recover after the COVID pandemic. Jeff himself absolutely hated a fuss. He much preferred giving attention to others than having that attention on himself. Helen told us that they both minimised difficulties. It was really, really important to Jeff that people thought he was invincible and doing well. And Helen never wanted to make Jeff feel like he was a burden. So she liked to put a rosy sheen on everything. And that's how they managed to cope with the difficulties that they were facing. They kept going and stayed positive. Helen wasn't recognised as a carer by anyone who worked with her and Jeff, although she was providing support to Jeff 24 hours a day. Helen talked to us about the attitudes of professionals towards her and Jeff and how this had both a positive and negative impact upon them both and their circumstances, especially when Jeff's health began to deteriorate. Helen told us that although their involvement with professionals was mainly positive, it was always task-focused and no one really asked how they were managing, not even when Helen was struggling to push Jeff in his wheelchair into appointments. No one had the professional curiosity to ask how they were managing with their day-to-day lives at home. Helen told us proudly that they had a folder at home with all of the contact numbers for services involved with Jeff, and they knew how to contact services in an emergency, but they never used them. Helen told us that Jeff's health significantly deteriorated and he could no longer stand up. By the time he was taken to hospital, he had lived entirely on the sofa for 16 days and nights. He was eating, sleeping, going to the bathroom in a seated position on the sofa. Helen went on to tell us that she slept in the armchair next to him because she was so afraid that he wouldn't be there when she woke up, and she was afraid that if he needed her, she wouldn't be there. Helen told us about their lives together and their lifestyle. Jeff enjoyed a drink of alcohol most days, and he continued to smoke, despite having been offered support to stop smoking by professionals. Due to his COPD, he'd also been advised that he would benefit from having oxygen therapy at home, but Jeff declined this as it would have meant he could not smoke due to the risk of fire. Helen had her own health needs. She'd overcome cancer and had several other significant health challenges. Helen told us, as did all of the professionals who worked with Jeff and Helen, that they both engaged really well with services. They attended appointments and responded to all requests made of them. So next, we're going to have a look at what happened in the last 2 months of Jeff's life. So before the last month of Jeff's life, he regularly attended his routine COPD and heart failure medical appointments. He actually had a COPD review 1 month before his health deteriorated. This was 2 months before he passed away. At this appointment, which was with a senior nurse practitioner, he talked about the deterioration in the skin on his legs, and a referral was made for him to see the district nurses, who he'd seen many times before. After his COPD review, his health began to deteriorate and the skin on his legs became infected. This is called cellulitis. Because his legs were so sore and infected, his mobility reduced. Previously, Jeff mobilised around his home, and he would use a wheelchair if he was going any distances, such as from the car to a health appointment. But he found that he could no longer do that. So Helen rang the GP, and because Jeff couldn't go to the surgery, a home visit by a GP was arranged. As we said earlier, Jeff's GP practice used another service to undertake home visits. So the GP that saw Jeff at home had never met him before and had limited information about his history. The GP assessed Jeff and prescribed antibiotics for the infection in his skin. He also asked how Jeff had got on with the district nurses, following the referral made at the COPD clinic the month before. Jeff said he'd not heard from the district nurses, and when the visiting GP checked with Jeff's own GP, the referral to the district nurse service had actually been rejected as it didn't contain sufficient information. So a new referral was made to community nursing service at this point. The antibiotics made Jeff sick, so they were changed for a different type. Jeff continued to deteriorate. His skin integrity deteriorated and he developed pressure ulcers on his bottom. He didn't move from the sofa. Helen was worried about Jeff and she called the GP surgery again. A second home visit was arranged with the GP visiting service. District nurses went to visit Jeff at home to assess his skin and they found pressure ulcers. They found him to be extremely unwell and advised him and Helen that Jeff needed hospital care. They called North West Ambulance Service to arrange for Jeff to be transferred to hospital as he needed to be taken on a stretcher rather than his wheelchair in a car. Jeff was admitted to hospital, but sadly he passed away a few days later on Christmas Eve. So let's talk through some of the critical moments in the last 2 months of Jeff's life. During the first GP home visit, which we already know was undertaken by a GP visiting service and not a GP that knew Jeff, Jeff was found to have developed an infection in the skin on his legs, cellulitis, and he had a chest infection. Sadly, due to Jeff's underlying health conditions, he'd experienced cellulitis and chest infections many times before. He was prescribed antibiotics and the GP chased up the referral to the district nurses made the previous month in his COPD review. It was only at this point that it was found that the referral had been rejected and a new referral was made. At this stage, let me point out the numbers in red at the bottom of the screen in the boxes. These numbers represent the number of days and nights that Jeff was living entirely on the sofa. So the next critical moment to focus on was the second GP home visit. Helen had called the GP as she was worried that Jeff was getting worse. He was vomiting because of the antibiotics and the skin on his legs and bottom were beginning to break down. Pressure damage was evident. New antibiotics were prescribed and the GP made a referral to the tissue viability service. The GP gave Helen and Jeff advice about what to do if Jeff got worse or displayed any signs of sepsis, and these signs were outlined to Jeff and Helen. At this point, Helen felt helpless and desperate. Both she and Jeff were sleeping in the living room. Jeff was physically unable to stand from the sofa and Helen was providing all care, including personal care. Helen felt that the GP was dismissive of her plea for help. He simply shrugged his shoulders when she asked what she should do. Jeff had been on the sofa for 12 days at this point. So next, the district nurses received the referral and they visited Jeff at home to complete an assessment. We already know that there had been issues with the referrals for the district nurse support up until this point. But at the point when they visited, the district nurses found that Jeff had severe pressure ulcers which were infected and he was very unwell. They discussed with Jeff and Helen that they thought it was unsafe for him to remain at home, and Jeff and Helen agreed. The district nurses phoned North West Ambulance Service and arranged for Jeff to be taken to hospital in an ambulance as he needed to be transferred on a stretcher at this point. It was no longer safe for him to be in a seated position. They were advised that a non-emergency ambulance would arrive within 4 hours and this was relayed to Jeff and Helen. Jeff had been on the sofa for 15 days at this point. However, there was a delay with the ambulance, and it wasn't until Helen phoned North West Ambulance after 22 hours had passed that the ambulance actually arrived. Jeff was taken to hospital, and the ambulance crew waited with him there outside A&E for several hours before being able to transfer his care to the hospital because the hospital was so busy at that time. Sadly, Jeff did not recover, and he passed away a few days later with Helen at his side. It was Christmas Eve. Jeff had been on the sofa for 16 days and nights. Okay, so let's talk through some of the key learning points identified by this learning review. So Jeff's health and well-being were deteriorating, and his choice to continue to smoke and drink alcohol resulted in falls and injuries for which he didn't seek medical support. He was offered support to reduce and stop smoking and reduce his alcohol intake, but he declined. However, there were missed opportunities to explore alternative support services which may have enhanced his and Helen's quality of life. Professionals engaging with people who are struggling to manage their own situations need to consider how wider services could help. Services such as the Falls team, adult social care, occupational therapy, the military veterans service, carer support, and activities via the community and voluntary services could have helped Helen and Jeff. The second learning point was identified, and it was that Jeff's records showed little evidence of his wishes and feelings or his understanding of his health conditions and treatment. People are experts in their own lives. We must ask and we must listen. It's vital that we empower people to have choice and control over how they wish to live their lives. Referrals made for Jeff did not always contain sufficient information. Referral pathways were sometimes unclear. Referrers were not informed that referrals had been rejected. And we know that happened with the district nurse referrals. So learning for us all is that referrals should contain as much information as possible and should particularly specify if a person is housebound. Communicating with each other is key. Another key learning point from this review is that Helen displayed compassion for the pressures upon health services, and therefore she didn't ask for support or express the difficulties that she and Jeff were experiencing because she didn't want to put pressure on services. Opportunities for carer support and adult social care support were missed, and delays in care occurred. It's really important to look out for signs that things are not right. Professionals need to have curiosity about what is happening in someone's life. We must empower people with information about what action to take if their situation deteriorates or services don't respond in the expected way. Another key learning point is that professionals recognised a missed opportunity to discuss the need for additional support due to fear of causing offence. Difficult conversations require confidence, practice, and experience. Seek support if you need it. So this learning review also identified lots of areas of good practice. Primary care offered robust monitoring and support to Jeff and his ongoing health conditions, and they ensured regular reviews were undertaken for his COPD. Red flag sepsis advice was provided to Jeff and Helen, and details of signs and symptoms which would require them to seek medical advice were left with them. Throughout this review, professionals involved with Jeff reflected on their own practice and identified areas of missed opportunities or gaps in practice. The district nurse team didn't discharge Jeff from their service until confirmation that his health care was in place and had transferred over to inpatient services. Jeff and Helen were left with appropriate information by the district nurse servicing, stipulating the need for escalation if Jeff's situation deteriorated during his wait for the ambulance. So finally, just some further information at the end of the session about what you can do and where you can go for further information. So I'd really encourage you to check out the Sefton Safeguarding Adult Partnership website for more information. On that website, you'll find lots of resources to support your practice. This includes dates and links to multi-agency training and learning events that run throughout the year. You'll also find briefings and information on a whole range of safeguarding topics. On the website, you'll find links to Sefton Safeguarding Children Partnership Board and Sefton Safer Together and the Domestic Abuse Partnership Board. You'll find contact details of how to make a referral for an adult if you are worried about them. And you'll also find information about how to make a referral for a safeguarding adult review. Thank you for listening to this recording, and I hope that you've had an opportunity to reflect on Jeff's situation and that this in turn has a positive impact on your safeguarding practice. Thank you.